So I'd like to ask the panel members for the next session if they would please come up and take their seats. Thank you very much, Christine, and thank you for the opportunity to moderate this afternoon's session. I have to say that as a resident of Boston, I hope that if I or a family member ends up in the emergency room, that we'll be there during Jonathan's shift. But all kidding aside, I think that it's clear to say that for both Dominic and Jonathan, that their personal experience has informed and created a whole different way that they approach their research and their clinical care. And I think it's part of our job to decide what's the best way to systematically infuse that across all clinicians and across all care settings in this country. And that's no small task. Before I introduce our speakers today, let me just review a little bit of what we hope to accomplish. This session is titled Patient-Clinician Communication and Tools for Change. And I want to underscore change. We need change. Why we need it is perhaps one of the most disappointing stories of American healthcare. But here we are today, poised to bring us to a new place where we can be proud to be part of a renewed system that we know will allow clinicians to be our guiding experts, and where we and those we care for will be treated with dignity and respect always. For this workshop, we are framing these presentations and those to come later this afternoon by thinking about 4 necessary steps to change. And I challenge us as we listen to these sessions and these presentations to think about what it is that we're learning, because this is really a hearts and minds issue, what it is that we're learning that we can bring back to our individual spheres of influence. What is the action that we can take? How can we infuse the knowledge from today and bring it forward? So these 4 steps are really guided the development of this workshop. And Christine mentioned one, which is pathways. So how do we kind of create that road or that avenue for us to kind of open up opportunities for the kinds of changes that we know that are needed, particularly in the culture of care? Infrastructure is number 2. That has to do with systems design. We've heard a little bit about that this morning. But we know for sure that in order to embed systematic and sustainable change, we really need to design things differently. And as Jonathan pointed out so eloquently, from the inside out, making sure that the patient and family is in that inside. The third is culture. These are customs of care that are deeply embedded in our system of healthcare. These are not easy changes, but these are changes that are going to be required in order for us to see the kind of successful results that we want to see. And last is competency. And that's really an important word in my mind. Competency on both sides of the coin. We're talking about skill sets, we're talking about confidence, we're talking about competency so that communication happens both ways and it's respectful coming from both sides. That doesn't happen quite much in our system today. As I was looking at the participant list last night while I was watching the Academy Awards, and I still can't believe that Argo won, it occurred to me that for most of you, this is a workshop that's a distinct recognition of the professional commitment that you have made to make healthcare a better place for all of us. Because as Dominic so eloquently pointed out, we are all patients. We are all people, but we are all patients. So we're really pleased today to have these dedicated professionals here with us to start this session. We have 3 presentations that are going to take us from the science that underscores the problem to innovative concepts for actually making infrastructural change to competencies. What does it need to look like for clinicians to be better at communicating and recognizing the value of patient and family contribution? So let me introduce our panel. Each of them has roughly 10 minutes to speak. And then after all the presentations, we're going to open it up for some conversation, question, and dialogue. We're going to begin today with Gary Langer. Gary is the founder and president of Langer Research Associates. He's an internationally recognized public opinion researcher with expertise in analysis of political, policy, economic, and social attitudes, questionnaire design, data interpretation, survey methodology, and survey management. Following Gary, we have Sherry Kaplan, who is the Assistant Vice Chancellor for Healthcare Measurement and Evaluation, as well as a Professor of Medicine at UCI, School of Medicine and Executive Co-Director of the Center for Health Policy Research at University of California, Irvine. She's a leading social scientist in medicine and has pioneered a number of areas of research, including demonstrating that patient involvement clearly leads to better outcomes. And our last speaker today is Eric Holmo. He's from the American Board of Internal Medicine. He's a board-certified internist. He's a senior VP of the American Board of Internal Medicine and the ABIM Foundation. His research interests include interventions to improve quality of care and methods in the evaluation of clinical competence. So on behalf of the Planning Committee, I'd like to thank all three of you for being with us today, and I'm going to turn it over to Gary. Thank you.